Biochemistry. Today we are having a quick look at the INICET Normal 2025 Biochemistry recall questions. All right. So starting with the first question, talking about the anion gap and seen in metabolic acidosis. This is what is known as the HAGMA, the high anion gap metabolic acidosis. Now, this metabolic acidosis and anion gap is an important and common question. For this, you must remember the mnemonic, which is the mud piles. You must remember this mnemonic, that is mud piles, which is associated with the high anion gap metabolic acidosis. So when you talk about metabolic acidosis, you have the normal anion gap metabolic acidosis and the high anion gap metabolic acidosis. For normal anion gap, you have the two conditions. One is the inherited renal tubular acidosis, and second is the diarrhea, where the chloride and bicarbonate are getting lost in the urine. But in all other conditions where you see the metabolic acidosis, additional anions are being produced in the body or they are being ingested, giving rise to the high anion gap metabolic acidosis. Now here the mud stands for methanol, M is for methanol toxicity, U is for uremia. Now for uremia you have to be careful. The uremia can be due to either acute or even due to the chronic kidney disease. So both acute and chronic kidney disease will present with the high anion gap metabolic acidosis, whereas the renal tubular acidosis, which is the inherited condition, will present with the normal anion gap metabolic acidosis. The D here stands for diabetic ketoacidosis. However, ketoacidosis from other causes like starvation and the alcohol intoxication. These are also going to present with the high anion gap metabolic acidosis. The P here stands for paraldehyde, the paracetamol, and the polyethylene glycol. Please note, recently we had the episode where the diethylene glycol toxicity poisoning was also causing the high anion gap metabolic acidosis. So you can have the DEG as well. The I stands for isoniazid, iron, and inborn errors of metabolism. Inborn errors of metabolism, whether they are related to the amino acid or other conditions, they are producing large amount of the anions, and they can also present with the high anion gap metabolic acidosis. L stands for lactic acidosis of any origin, any cause lactic acidosis. E stands for ethanol toxicity, and S stands for salicylates like aspirin. So these are some of the important and common causes for high anion gap metabolic acidosis. Sometimes you can get the clinical question also, where they will give you an idea for making the diagnosis, and then they'll give you only the pH value without giving the values for the bicarbonate and the PCO2, asking you to identify the type of acid base disorder. So when you see any of these conditions and the acidosis part is already mentioned in the question, then you know we are looking at the metabolic acidosis. We are already looking at the metabolic acidosis. So in this case, the starvation and decay, both will cause options are incorrectly matched. Okay, both will cause the high anion gap metabolic acidosis. Severe vomiting is associated with the metabolic alkalosis. Okay, H plus is being lost in the gastric juices which are being secreted, and to compensate for that, there will be buildup of the H plus. Okay, so a severe vomiting will result in the alkalosis rather than the acidosis. All right, so this is about the metabolic acidosis and the anion gap, whether it is normal or it is increased in the different conditions. Coming to the next question, talking about xanthuranic acid presence in the urine, the presence of xanthuranic acid in the urine. In this question, the image was shown where there was conversion from the hydroxyquinurine, and the cause, which enzyme deficiency is going to result in the xanthuranic aciduria. So what happens normally, the hydroxyquinurine is getting metabolized into the NAD, and in this reaction the B6 pyridoxal phosphate is required. If the B6 is not available, if B6 is not available, in that case hydroxyquinurine gets metabolized to the xanthuranic acid. So this means that pyridoxine deficiency will be associated with the xanthuranic aciduria. In this condition, you also get to see the oxaluria and the homocystinuria. These are three classical urinary findings in the pyridoxal phosphate deficiency. Additional findings which you may see include the sideroblastic anemia, and you might also see the peripheral neuropathy. You might as well see the peripheral neuropathy. So these are the additional findings that you see in vitamin B6 deficiency. Please note, the vitamin B6 deficiency is mostly iatrogenic, that is, it is treatment induced mostly due to the different types of drugs. Classically it used to be due to the isoniazid deficiency, but nowadays less commonly we see isoniazid being associated with B6 deficiency because of supplementation. Other drugs, a lot of other drugs also use up the B6 during their metabolism, giving rise to the B6 deficiency. Okay, so here the answer is the vitamin B6 pyridoxine, or the pyridoxal phosphate, is the deficient enzyme resulting in the xanthuranic aciduria. Okay, now you have a clinical case. 24-year-old female presents with low hemoglobin, easy fatigability, tingling sensations in hand and feet, along with altered proprioception. So you can see here we have the clinical picture of anemia. We have the clinical picture of anemia along with the neurological defects, or the neurological deficits are there. So please keep in mind, anemia along with neurological features, we are dealing with the B12 deficiency. If it is only anemia, it can be because of a lot of other reasons. If it is megaloblastic, then it will be 9 deficiency. If it is iron deficiency anemia, where you'll have microcytic hypochromic condition. So a lot of other features can be there, but when you say anemia along with neurological deficits, you have to think about B12 deficiency, because in B12 deficiency you have the megaloblastic anemia along with subacute combined degeneration of the cord, that is the SCD or SCD or the SACD. All right. Now in this case, further it is mentioned that treatment with folate supplementation caused worsening of neurological symptoms. Now what happens in these cases is there is the store of tetrahydrofolate in the form of methyl tetrahydrofolate in our body, right? This methyl tetrahydrofolate has to be mobilized in the form of tetrahydrofolate, and from tetrahydrofolate you can form the active components of the tetrahydrofolate, including the formyl form, methinyl form, methylene form, formamino form. So you have different conformations in which this will work, right? For this reaction to be completed, B12 is required, and the homocysteine is getting converted into the methionine. Now if there is the B12 deficiency, in that case this reaction tends to get blocked. The homocysteine will accumulate, and the tetrahydrofolate is not formed, and this results in what is known as the megaloblastic anemia. All right. So if tetrahydrofolate is not there, in that case also you get the megaloblastic anemia. If B12 is not there, in that case also you get the megaloblastic anemia. However, If it is due to the B12 deficiency, in spite of having adequate amount of tetrahydrofolate, folate, this condition is known as the folate trap. This is another very common and important question. What is folate trap? When you have adequate amount of tetrahydrofolate, folate, but it is not being utilized by the body because B12 deficiency is there. All right. So what happens in this case is, suppose you have a borderline B12 deficiency where the neurological symptoms have not yet appeared, and you supplement with the B9, which is mentioned in this case. So what will happen? There will be large amount of the methyl tetrahydrofolate. Now because there is large amount of methyl tetrahydrofolate, this reaction will be favored thermodynamically. This reaction will be favored. So whatever little bit of B12 is there, it will be diverted towards this reaction, and now the B12 will not be available to fulfill its neurological role, which is it is helping in the myelination of the neurons. Okay, it is helping in the myelination of the neurons by modifying one of the amino acid. So that particular role is lost and myelination will get affected, giving rise to the subacute combined degeneration of the cord, and that is when you will see the worsening of the neurological symptoms. All right, worsening of the neurological symptoms will happen in this case because now B12 is forced to involve itself with the B9 recycling, because B9 levels are very high. So in this case, the correct answer should be folate trap. The more correct answer would be that supplementation of folate diverts B12 use and neurological symptoms are worsening due to defect in the demyelination. Folate not absorbed, there is no mention of folate not being absorbed. Unmarked pyridoxine deficiency doesn't have anything to do with neurological worsening, and deficiency of folate reductase in CNS again not justified with the information provided in the question. So your next best answer is the folate trap, which is due to the B12 utilization. Now the next question is slightly tricky. Here they have said which enzyme defect will lead to increasing 2,3-BPG and the low glucose in vitro. Now see, these are two important and different parts. The increase in 2,3-BPG can be due to two reasons. One, pyruvate kinase. Second, phosphoglycerate kinase. Both of them can result in increase in 2,3-BPG. How? Very simple. Very simple. See, if you look at the glycolysis reaction, you have this substance 1,3-BPG. 1,3-BPG is getting converted into the 3-phosphoglycerate, and ultimately it is getting converted into phosphoenol pyruvate, which goes to the formation of pyruvate. Now the two enzymes which are mentioned here, the pyruvate kinase will work at the last reaction. Pyruvate kinase will work at the last reaction, whereas the phosphoglycerate kinase is working from conversion of 1,3-bisphosphoglycerate to 3-phosphoglycerate, which happens to be a reversible reaction. Right. Now if any of these two enzymes are getting blocked, there will be gradual buildup of 1,3-BPG, right? There will be buildup of 1,3-BPG, and then it is diverted towards the Rappaport-Lewis shunt, where there will be synthesis of the 2,3-BPG. So you will find increased level of 2,3-BPG in both the conditions. Okay. Now the second part is the one where it becomes tricky. Low glucose in vitro. If there is blockage of the pyruvate kinase, it is in no way related to the glucose formation and the glucose levels. But if you block the 3-phosphoglycerate kinase, then you are blocking the gluconeogenesis, because gluconeogenesis involves the reversible reactions of glycolysis. You are blocking one of the reversible reactions of glycolysis. In that case, the 2,3-PG will be elevated, but along with that you are also going to have the low blood glucose. So the correct answer in this case is the phosphoglycerate kinase. The G6PD and hexokinase will not cause the elevated 2,3 BPG level. They are not going to cause the elevated 2,3 BPG level. Okay, so slightly tricky question, but now you know how to approach this question. Now this is a very interesting curve which was asked in the question. In the question it was a hand drawn. The same image was drawn by hand by some student which was given in the exam. But in this case we have taken the actual original image which is there. Now you can see there are multiple graphs. Out of 5 graphs, 4 of the graphs have been labeled as 1, 2, 3 and 4. And the question asks which of the curves will show patient with diabetes mellitus. If you look at the graph carefully, it has the values of glucose concentration and the time frame at which these values have been obtained after administration of glucose. That is why the name is oral glucose tolerance test. In oral glucose tolerance test, you give the 75 gram of anhydrous glucose and then you measure the glucose values in the blood and urine after every half an hour. This is the extended oral glucose tolerance test. What we do nowadays is the mini OGTT, where you take only 2 samples, one at 0 hour, one at 2 hour, all both in the blood. Okay, in the previous question, if I go some comments I can see, yes, low glucose, as per the feedback from most of the students, the low glucose was mentioned in the question, and the Rappaport bearing shunt was not mentioned. But the Rappaport bearing shunt will come into picture here. It only mentioned that 2,3 BPG is elevated. It mentioned 2,3 BPG. Didn't mention the Rappaport bearing shunt. I'm just telling you that. And the Rappaport bearing shunt is the one which generates the 2,3 BPG. Okay, so that part was not there in the question. It was only saying that 2,3 BPG levels will be elevated. Okay, talking about this graph showing the OGTT, oral glucose tolerance test. The classical OGTT has 7 values. The mini OGTT that we use is having only 2 values, and that too only from the blood. Okay, RBC is mentioned, then that is perfectly fine. Then it validates that the Rappaport bearing shunt is happening only in the RBC. Thank you very much, Dr. Harshit, for the feedback that it mentioned the RBC also. Great. Okay, so the oral glucose tolerance test, in this case, what you have to keep in mind for making a diagnosis of diabetes, the two features that we use in the OGTT. One is the fasting glucose. One is the fasting glucose value, and second is the 2-hour glucose value in blood. We are looking at these values in blood. So if fasting glucose value, if it is greater than 126 milligram percent, fasting glucose value if it is greater than 126 milligram percent, or the 2-hour value if it is greater than equal to 200 milligram percent. In both the cases, we are looking at a diagnosis of diabetes mellitus. So you have to look at the graph. For these particular parameters, right? So as you can see here, as you can see here, 126 would be somewhere here. It would be somewhere here, and similarly 200 limit is shown here. Right? The fasting value is here and 2-hour value is here. So these are the reference points on our graph. Which we have to use. Right? Now see, at 0 hour, that is fasting, you can see the first graph which can be highlighted close to 126, may or may not be crossing, we are not sure. The second graph is definitely crossing the 126 threshold. It is definitely crossing the 126 threshold. So this is likely to have diabetes mellitus. If you follow this graph further, at 2-hour value, definitely the value is more than 200 milligram percent. So the graph number 3 is also likely to have the diabetes mellitus. Looking at graph 2 and 1, fasting value less than 100, so definitely not falling into the definition. The 2-hour value again less than 100, so definitely not falling in the definition of diabetes mellitus, meaning only 3 and 4 are the scenarios which corresponds to the diagnosis of diabetes mellitus. So you have to choose the option having 3 and 4 which are mentioned. Graph 3, graph 4 are showing curves for patients with diabetes mellitus. Graph 3 and 4 are showing curve in the mellitus. Okay, great. Music X has given the correct answer. 3 and 4 is identifying the patient with diabetes mellitus. All right. So we go to next question. In this question, there was description about a patient having the von Gerke's disease. So some of the features which you can see in patient of von Gerke's disease would be a fainting episode. On examination, in these patients, you will find the liver and kidney are being enlarged, and a very characteristic feature which is the doll-like faces. Doll-like faces is another very characteristic feature in patients of the von Gerke's disease. And at the end in the question it was mentioned that a provisional diagnosis of von Gerke's disease is made. And last part of the question was, which is the most common symptom? Which is the most common symptom? Very good, very good. Music X is also given answer for this one. Which is the most common symptom in this condition? See, if they mention common, then it is something different. If they mention most specific, then the answer will change, right? Because hypoglycemia, which is the most common symptom, is a common feature of other several other GSDs also, right? So you can't just have the same answer for different questions. You have to read the question very very carefully. In this case they had mentioned the common term as told by all of you, and in this case our answer should be the fasting hypoglycemia. Most specific will be the enlargement of kidney and liver, because this is seen only in the GSD type 1A, that is von Gerke's disease. So that would be more specific finding in patients of von Gerke's disease. The fasting ketosis, hypercholesterolemia, the decreased glycogen in liver is not seen here. Fasting hypoglycemia, these are common features in a lot of other GSDs also, but the most common is the fasting hypoglycemia, which occurs right from the beginning. Okay, correct answer, Music X. Great. Then we had another question where they were giving the description of a patient having the G6PD deficiency. So a person of Mediterranean origin has visited Africa, where he suffered from malaria, then treated with drugs with high oxidative potential. Treated with drugs having high oxidative potential. Okay. So in that case, there is an hemolytic episode. Further, the question mentions that G6PD enzyme from HMP shunt is presumed to be deficient, meaning we are dealing with the G6PD deficiency or the favism. Now, they didn't ask about the favism per se, then they asked about what the shunt from which this enzyme is there, that is HMP shunt. What are the features of that shunt? So if you look carefully, no ATP production is correct, because HMP shunt doesn't produce ATP, it doesn't consume ATP. Produces ribose 5-phosphate, but it doesn't produce oxygen, it uses up oxygen. It doesn't produce NADH, it rather produces the NADPH. So option 2 is not correct. Transketolysis requires thymine is correct, and non-oxidative phase is reversible is correct. We have a oxidative phase. Oxidative phase is irreversible, and then we have the non-oxidative phase which is reversible. So what you can see is 1, 3 and 4 are correct. 1, 3 and 4 are correct. You can see here that 1, 3 and 4 happen to be correct. Okay, Music X again given the answer D, which is correct. Very, very good, great going, Music X. So we move on to next question about the TCA cycle. Now this was a very straightforward question, mentioning in TCA cycle which intermediate serves as main substrate for fatty acid synthesis. Which intermediate serves as main substrate for fatty acid synthesis? So what you have to remember here, that when you're talking about fatty acid synthesis is taking place in the cytoplasm. It is taking place in the cytoplasm, whereas the TCA cycle is happening in the mitochondria. It is happening in the mitochondria. So in this process, what happens when acetyl coenzyme A is combining with oxaloacetate and forming the citrate, right? When there is excess amount of acetyl coenzyme A and you end up with excess amount of citrate, there is a dedicated transporter, the tricarboxylic acid transporter, which has very low affinity. Low affinity means it is able to work only when the citrate levels are very high. This transporter will transfer, yes, this transporter will transfer some citrate in the cytoplasm. Very good. Harshit has given the first mnemonic: citrate synthesis, carnitine carnages. Very good. Fatty acid synthesis through the citrate shuttle will come out, and then it will be acted upon by the citrate lyase. Citrate lyase will cleave into oxaloacetate plus the acetyl coenzyme A. The acetyl coenzyme A will go towards the fatty acid synthesis. So correct answer in this case is citrate. Correct answer in this case is citrate. Wonderful. Harshit, Music X, they have mentioned some points which others can take a look at. The citrate will cause synthesis of fatty acid. Carnitine will cause breakdown or carnage of the fatty acid. So fatty acid synthesis, citrate shuttle, and breakdown is the carnitine shuttle. Great. Very good. Wonderful. So the answer here is the citrate, which is serving as the main substrate for fatty acid synthesis. Moving on to one of the favorite question of the examiners. Very frequently they are talking about the Gaucher's disease. So please don't forget, when you talk about Gaucher's disease, that there is something known as the Gaucher's cell. Sometimes they'll give you the image, sometimes they will give you the description of this Gaucher cell, as they have done here. Gaucher cell is having the crumpled or wrinkled tissue paper appearance. Crumpled or wrinkled tissue paper appearance. Wonderful. Music X has again tried to give the answer for this question. And in Gaucher's disease, the deficient enzyme is the glucocerebrosidase, the beta glucocerebrosidase A and C. Rahul has also given the answer. Wonderful. So these are some of the characteristic features. In Gaucher's disease, you also have to remember, most commonly it is the abdominal pain with which the patient will present, but you can also have the presentation with the bone pain, also known as the bone crisis. The Gaucher's disease is the most common lysosomal storage disorder, and also remember, it is also the first condition for which enzyme replacement therapy was made available. Okay, that is why it is asked very frequently. As we can see, option A and option C are correct. The option B and option D, these are more likely to be seen in the Niemann-Pick disease. The sphingomalanis defect is the Niemann-Pick, and where you are more likely to see the foam cells, Alright. Yes, Eller-Mayer deformity can also be one of the features. So B and D are related to Niemann-Pick. A and C in this case are related to the Gaucher's disease. So correct answer in this question would be the A and C. Correct answer will be A and C. So first they asked about the synthesis, then they had another question on the oxidation. So as you can see in this question, they are talking about the beta oxidation. All right. So now in beta oxidation, what is happening? There is a component of activation, there is a component of transport, and then there is a component of the breakdown. Now for activation, the ATP is used. 2 ATP equivalent or 2 high energy phosphate are utilized, but here they mention ATP is generated. This is not correct. CPT1 will convert the fatty acid into acyl carnitine, and the CPT2 will convert it back to the acyl coenzyme. So CPT1 and CP2 both are present in the mitochondrial membrane, but in different layers. please note, if this is the mitochondria composition where the cytoplasm is here, the matrix is here, you have the outer mitochondrial membrane, the inner mitochondrial membrane, and the inner membranous space. So in this case, the CPT1 is in the outer layer, the CPT2 is in the inner layer. So please remember, they both are present in the mitochondrial membrane, but in two different layers. One is present in the outer membrane, the second is present in the inner membrane. So they are present in the two different layers. However, both are present in the mitochondrial membrane itself. Coenzyme is released in the cytosol during formation of acyl carnitine. This is somewhat correct. Somewhat correct. Why? Because the reaction actually happens here. So the more correct statement should be that it is released in the intermembranous space, from where it can diffuse to the cytosol. And carnitine is released by the CPT2. Okay, so it is released by the CPT2, so that is released in the matrix side. This statement is also correct. ATP is used was the option. Did they mention some compartment? Okay, when you're doing the recall, then also this confusion was there whether ATP was used or it is generated. Okay, so if it is mentioning ATP was used, okay, this is correct. In that case, you have to go for which one to choose. See, 1 and A and D are perfectly right. If they are mentioning the compartments, and if what we are writing as compartments is correct, in that case, if no compartment is mentioned for ATP, in that case we keep the B as correct answer and go for C, because C the more correct. If it is only mentioning that ATP is utilized during the process, then that is the correct statement. ATP is utilized during the process for activation is the correct statement, but the coenzyme A has to be released in the intermembranous space, right? So the more correct answer should be intermembranous space. So if you're saying that ATP is utilized in the process, only that part is given. In that case, your correct answer becomes option C, that the coenzyme is released in the intermembranous space, not in the cytoplasm. Okay, it is released in the intermembranous space and not in the cytoplasm. Alright, so based on the feedback that you are giving me, the correct answer should be option C. However, I have told you the other factors which you have to keep in mind. CPT1 and 2 are present in two different membranes of the mitochondria. The ATP is being utilized, 2 ATP equivalent are utilized when you convert the fatty acid into the acyl coenzyme A. When you're doing this conversion in this reaction, very good, in this reaction what we are doing, the ATP is getting converted into AMP, so we count it as 2 ATP equivalent. All right, Harshit, I agree with you that other three can be ruled out, they are correct, and we go with option C as the correct answer. Great, thank you for your feedback. These feedbacks are very valuable, because as you know, these are recall questions. So if it is only due to your feedback that we are able to recreate the questions which have been asked in the exam. Okay, match the following question has been coming for last 3 exams repeatedly. They're giving this table about the special products of the amino acids, so it is very important for you to make sure you revise the special products of amino acid before you go for the exam. And the molecules which are being asked again and again are the same: tyrosine, tryptophan, glycine. Cysteine is getting changed, the fourth option keeps changing, but the first three are commonly appearing in the exam. So remember, tyrosine will give rise to the thyroxine hormones. It will give rise to the catecholamines. What are the catecholamines? Dopamine, norepinephrine, epinephrine. These are the catecholamines coming from tyrosine, and you also get melanin. Tryptophan gives rise to melatonin, serotonin, and vitamin B3, that is the niacin. Okay, glycine is involved in the formation of creatine. Glycine is involved in the formation of heme ring. Glycine is involved in the formation of purine ring. Glycine is involved in the xenobiotic metabolism. Glycine is involved in the synthesis of glutathione. Alright, it is involved in the synthesis of glutathione. So a lot of places where we make use of glycine. Cysteine is involved in taurine and the glutathione synthesis. If you look at glutathione is made up of glutamate, cysteine, and glycine. The biochemical name is glutamyl cystenyl glycine. Okay, so if you look at the options, A should be 1. Okay, so this is out, this is out. B should be 2, so this is out. B is 2, C is 3, and D is 4. Option A is the correct answer. Option A is the correct answer. As you can make out that I have matched it correctly to avoid confusion for you in recalling and memorizing this aspect. But nevertheless, you have to go to our video and see where we have talked about the special products of amino acids. We have some very important products coming from the amino acids and being asked repeatedly in the exam. Okay, so you have to look at those special products of amino acids in our video lecture. Okay, moving on to next question. Here they have mentioned a clinical scenario and which shows increased expression of some of the genes. It shows increased expression of some of the genes. Now they have asked which epigenetic change is most likely to explain this. Which, yes, music X, that is correct. For creatine synthesis, glycine, arginine, methionine, all three are required. All three are required, right? Okay, so in this case, when we talk about epigenetic changes, when we're talking about epigenetic changes, you have to keep in mind two things. Methylation of DNA. Methylation of DNA means decrease. Methylation of DNA means there will be decrease. Second, there is acetylation of histone. When there is acetylation of histone, there will be increase in gene expression. These are the two facts that you remember when we talk about epigenetic changes and their effect on gene expression. So when there is methylation of DNA, then it will decrease. When there is acetylation of histone, then it will increase. So here you have to see which one increases the expression of TNF alpha and IL-6. When you activate the DNA methylation, it will suppress. So that is not the correct answer. When you inhibit the DNA methylation, in that case the down regulation does not happen. If you activate the histone deacetylase, the acetylation will be decreased, so it will not cause activation. Similarly, if you inhibit the acetylation, then also activation of histone will not happen. So you can see the correct answer here is option B. So music X, histone deacetylase inhibitor was given. If it was the inhibitor, of histone deacetylase, then it becomes the correct answer. If you are inhibiting the histone deacetylase, that is, histone stays in the acetylated form, then that is the correct answer. Anyone else has some comments on the option besides music X? Music X is saying that it was the inhibitor of histone deacetylase. In that case, it becomes the correct answer. B option was not there. Okay, B option was not there. So in that case, if it mentions inhibitor of histone deacetylase, then it is the correct answer. Basically, you should understand the concepts. What are the effects of the covalent changes? Methylation of DNA will cause decrease in gene expression. whereas acetylation of histone will cause increase in gene expression. So whatever combination fulfills these conditions and correlate with the question, accordingly you are going to mark. So anything which is preventing the methylation, it will cause activation. Anything which is promoting the acetylation of histone, that will also cause activation. So accordingly you have to mark the answer. So if it mentions histone deacetylase inhibitor as one of the options, then that should surely be the answer. Inhibitor of histone deacetylase is present for sure, then that is the correct answer. If inhibitor of histone deacetylase is present, then that is the correct answer. Thank you, Dr. Astit, for verifying the option. So in that case, we go with option C, that inhibitor of histone deacetylase, that will be our correct answer. Thank you very much for your valuable feedback. That is how we get to know the correct question when we are discussing it with all of you. Now this question had lots of confusion when we are doing the recall. A cancer cell shows a different RNA transcript when compared to normal cells. What is the most likely reason for this? Now, the gene amplification will not cause a different RNA transcript, it will only make more RNA copies. Okay, gene silencing will not cause a different RNA transcript, it will cause less number of RNA copies, Similarly, polyadenylation is related to regulation. It is not going to affect the transcript, it is going to affect the regulation, whether the microRNA is able to attach in the UTR region or not, because this polyadenylation part is the present in the 3' untranslated region. It is present in the 3' untranslated region. The given drug that is histone deacetylase inhibitor. Okay. Harshit, thank you for your feedback. We will modify the question accordingly, that in a rheumatoid arthritis patient, a drug is given. Okay, drug which is, oh, so you're changing the question. What explains this? Okay. All right. Thank you, Dr. Harshit, for your feedback. We'll modify the question accordingly. Coming back to this question on cancer cells. So polynylation is affecting the 3' UTR. So it is also a regulatory component. It does not affect the different RNA transcript. The only thing which can modify the RNA transcript is the alternative RNA splicing. The only thing which can modify this is alternative RNA splicing. So I'll just briefly mention what is happening when you have the heterogeneous nuclear RNA. It has all the different exons. It has all the different exons which are present in the genome with the cap and the tail. After splicing, let's say this is number 1, this is 2, 3 and 4. After splicing, you get a certain combination of the exons. Sometimes you can get all 4 exons, but sometimes you might get only one specific combination. For example, 1, 3 and 4 is giving you the protein. Exon 1, 3 and 4 come together and then you get the protein. But when there is alternative splicing, in that case, instead of 1, 3 and 4, you might get a combination of 2, 3 and 4. You might get a combination of 1, 2 and 4. You might get a combination of 1, 2 and 3. So different combinations might be generated due to this alternative splicing. The different RNA transcripts might be generated. So in this case, our correct answer is the alternative RNA splicing. So the thought about the B100 and B48 worked for you, but B100 and B48 do not have alternative splicing. Rather, there we have more of the RNA editing. The changes are occurring in the cytoplasm, not in the nucleus, whereas the alternative RNA splicing occurs inside the nucleus itself. But nevertheless, it worked for you, so that's great. Okay. Moving to next question, talking about elongation factor 2 inhibitor or a toxin, and there were various statements where you have to identify which one is the incorrect statement. So first and foremost, ApoB148 is an example of RNA editing. It is an example of RNA editing and not alternative splicing. In RNA editing, what is happening? There are changes in the RNA once it reaches in the cytoplasm. There is a small modification of the nucleotide introducing a stop codon. All right, so we are talking about elongation factor 2 toxin. You have to remember, elongation factor 2 toxin is the diphtheria toxin. Diphtheria toxin is the elongation factor 2 toxin. Diphtheria toxin is the elongation factor 2 toxin. Now, all the information is related to this diphtheria toxin. Diphtheria toxin is an exotoxin produced by Corynebacterium diphtheriae only when the phage is present. Why? Because the gene for the toxin, the tox gene, is present on the genome of the bacteriophage. It is present on the genome of bacteriophage. Yes, so it is present on the genome of bacteriophage, and the change that you see is on elongation factor 2. The ADP ribosylation is happening on the unique amino acid diphtamide. Image was given. Okay, its whole mechanism of action was present. That's very good. The image, so we will add the image when we upload it on the app. We'll add the image in this question, that the image was given. We'll make sure to add this to the main question when adding it to the app. All right, so the whole mechanism of action was shown, and you have to remember the points that it is the exotoxin produced by Corynebacterium diphtheriae when the phage is present in the lysogenic state. It is not the most lethal toxin. It is quite toxic, but it is not the most lethal toxin. That means qualification or credit or merit or crown goes to ricin. Ricin is considered one of the most lethal toxin, but not the diphtheria toxin. So most lethal toxin is not a correct statement or information regarding the elongation, the elongation factor 2 toxin, that is the diphtheria toxin. Dr. Asif Chauhan, if you could send a little bit about the statement separately about sorry, Ashish Yadav, about the previous question. We would like to incorporate that. Okay, so that's elongation factor 2. It is not the most lethal toxin. The other points I have already told you about that. The image was given showing the mechanism of the toxin. Okay, then we have a question mentioning the M13 bacteriophage, which is used in molecular biology to identify the specific gene sequences of COVID-19 virus. This part was mentioned, that COVID-19 virus genome is being deciphered using this bacteriophage through expression of the inserted gene fragment. Okay, so this mechanism when you're using the bacteriophage, in that case it is either the phage display or the phage expression. Cosmet expression was one of the options. Here the cosmet expression, okay, we can add the cosmet expression as one of the options. One option, cosmet expression, not phage display. Only M13 was written, bacteriophage was not written, and one of them was the yeast expression I have mentioned here. And bacterial expression, cosmet expression, and phage, not phage display. Phage display was not mentioned. Was the phage expression mentioned? Yeast expression, M13 mentioned, only that I have corrected already. Any other option? Bacterial expression, yeast expression, cosmet expression. What is the fourth option? Page expression was given, right? So if Page expression is mentioned, then it is the correct answer, because M13 is the bacteriophage, and we are using the phage plasmid. We are using the phage plasmid, and as the genome, and we are inserting the gene within the phage. So this is the phage expression. This is the phage expression, which should be the correct answer. If M13 was not there, something else was there. If you're looking at a bacteria, if you're looking at bacteria, in that case we're using the plasmid, and then it will become the cosmid expression. Okay, but if you're using the phage, then it is the phage expression. We are inserting the uh, gene within the phage. All right, in this question, something regarding antibody production. Yeah, so COVID-19 virus, certification of COVID-19 virus antibodies, it may be some part of antibodies may be mentioned, but overall the mechanism is what we are interested in, that how the different systems are being used. So when we mention M13, it is a bacteriophage, and the mechanism will be the phage expression. If you look at the Lac-Operon model, when you're looking at the Lac-Operon model, I understand. I understand that full bacteriophage is not written, but M13 is a bacteriophage. That's what I'm telling you. M13 is a bacteriophage. So in this case, it is a phage expression. If it were saying about the Lac-Operon model, the modified Lac-Operon model which you use for the genetic engineering, in that case, it would have been the cosmid expression, because there we're inserting the gene in the plasmid. All right. So in that case, it becomes the cosmid expression. If you add the gene into the genome of the bacteria, then it becomes the bacterial expression. Similarly, if you add the gene in the genome of the yeast, then it becomes the yeast expression. So depending on where the genome is being added, based on that, these names are their bacterial expression, the cosmid expression, the phage expression, or the yeast expression. In case of M13, we are introducing the extract DNA within the genome of the bacteriophage. So this is the phage expression. In this case, if phage expression was there, then that will be the best answer. Cosmid expression would not be the correct answer, because the expansion and expression is happening in the bacteriophage, not within the bacteria. All right, going on to next question. This is one of the hot favorites of the examiner. Every year you're getting the question on polymerase chain reaction. This is one of the simpler questions, one of the very simpler questions, where you have to identify the steps of the polymerase chain reaction, right? So please note the step 1, 2 and 3 of polymerase chain reaction. First you separate the two strands of DNA, then you allow the primer to attach, and then you allow the primer to get elongated. Please keep in mind that step 1, 2 and 3 make up one cycle, in the polymerase chain reaction. Typically you have anywhere between 30 to 40 such cycles, is there in the polymerase chain reaction, which is then followed by the step 4, which is the final elongation step. We also have what is known as the final elongation step. The step 1, 2 and 3 are performed for a few seconds, whereas the step 4 is performed by several minutes. This is the main difference between step 3 and 4. 3 and 4 are essentially the same, with the difference in the time duration. Step 3 is running for a few seconds, whereas step 4 is running for several minutes. In PCR the hybridization is not happening. Hybridization will happen when you are labeling. Okay, so in PCR the hybridization is not happening. What is happening here is the denaturation, annealing and extension. So the correct answer in this case will be step option A, denaturation followed by annealing followed by extension. Sometimes you might get step 0 in the question. Please keep in mind step 0. Okay, step 0 will be design and synthesis of primer, because without synthesizing the primer you cannot actually perform the polymerase chain reaction. So some authors like to mention step 0, that first and foremost you have to design and synthesize the primer, then you do the actual reactions of the polymerase chain reaction. So sometimes you might get as design synthesis of primer followed by denaturation, annealing and extension. So that is step 0, the initial critical step. State of extension, elongation was given. Both are the same. Even if extension or elongation is given, they mean the same thing. Either extension or elongation, any of the two means the same thing. It doesn't change our answer. Elongation or extension, any of the two, it doesn't change our answer. It means the same thing. So I think these are some of the questions clearly coming from biochemistry. There were some overlap questions, some from microbiology, some from pathology, which I have not touched. One question from physiology also talking about magnesium. So I have not touched those questions. They are being covered by the different faculty for you. I thank all the attendees for your very valuable feedback that you have given to us. We'll incorporate those feedback into the questions while we upload the question on the app. All right, and I wish all of you the best of luck for your exam result. But if you have made some mistakes, do not worry, take them as a learning point and utilize those mistakes to achieve better score in your the NEET PG exam. So it will help you and enhance your understanding and knowledge for the next paper. Okay, so for any doubts or queries, you can ping me on on my number, which is there on the screen. Yes, there was a question on VDJ rearrangement, that is correct, but I've left it for microbiology. That question is being covered in microbiology section, so I'm not going there. And so that will be covered in microbiology section. So thank you very much. Take care and best.